Officials have repeatedly assured local residents that there is little or no risk from the extensive deposits of natural asbestos discovered across much of southern Nevada. And they backed up that position by saying that the famed Centers for Disease Control agrees with the state's position.
But hundreds of internal emails obtained from the state by the 8 News Now I-team show a much different reality. Tonight, George Knapp lays out the email evidence and shows how state officials distorted the position of the CDC.
Asbestos exposure has always been related to disease. How you can say that you agree to expose your children to that? I cannot believe that.
Dr. Francine Baumann was stunned when the state of Nevada banned her from the Nevada Cancer Registry and threatened legal action if Baumann and her colleagues, UNLV professors Brenda Buck and Rod Metcalf, went public with their findings about a possible link between natural asbestos and higher levels of deadly disease in southern Nevada. After the state sent this cease and desist order, Baumann and her team spent more than a year reconstructing their findings using health data from the CDC instead. Baumann says CDC officials told her they were appalled by Nevada's action and that she should ignore the cease and desist.
My colleagues working in CDC, for them, I should have published my data and anyway.
At the same time CDC was cooperating with Baumann, behind the scenes, top health officials here were desperately trying to get the CDC's endorsement for their position, namely that natural asbestos poses no risk to public health. Top health officials were still fine-tuning their message this past February. A PR staffer asked her boss, Chief Medical Officer Dr. Tracy Green, to approve some copy. "How's this?" she wrote. "Dr. Green is always concerned about the public's health and well-being. Now that we've discovered natural asbestos, we'll keep our eyes open and intensify our research." But a follow-up email the next day shows the state epidemiologist referring to asbestos as a, quote, made-up issue. From the beginning, state officials played word games with reporters by implying that their position was endorsed by the CDC. The state's original Talking Points memo boasts how the state had consulted with NIOSH and CDC. In reality, those respected entities never endorsed Nevada's analysis. By February 2014, Tracy Green seemed nervous. "I have a meeting at the governor's office tomorrow to follow up on asbestos." She wanted to know if the state had a letter from CDC. Green's staff members had reached out multiple times asking CDC to validate the state's position on asbestos, but CDC would not play ball. On their web pages, CDC and NIOSH make it abundantly clear they consider natural asbestos to be a serious risk to public health. In December, the state epidemiologist took one more stab at it, praising CDC as the most trusted public health agency in the country and asking for a statement or email which agreed that Nevada's disease rates are not out of line. By that time, reporters were asking the state to show proof that CDC agreed with their analysis. A frustrated PIO told her bosses she'd looked through all the emails but couldn't find a letter from CDC to dispute Dr. Baumann. Since no such letter existed, Tracy Green suggested another approach. This single sentence epitomizes the state's approach to the science of asbestos. Is there a way, Dr. Green writes, to explain CDC data as consistent with ours, not the other investigator from Hawaii? Punctuated with a smiley face. On December 11th, CDC finally responded, but it wasn't the answer the state wanted to hear. "We can't comment on state analysis as to validity or non-validity. If you want an independent review, a university might be a good choice." It took less than an hour for state officials to put this spin on CDC's statement. It's good then. CDC endorses what we've already done. In every internal email or public statement since CDC's rejection letter, state officials continued to parse words. "CDC corroborates our findings," one health official wrote in February, and in interviews,
"Can you tell me if we are wrong or the researcher is wrong?" And turned out to be that the researchers which we contacted and CDC did not validate what it was published.
Dr. Azam told us CDC had not validated the analysis of Dr. Baumann, while neglecting to mention that CDC doesn't do such validation for anyone, including the state of Nevada. George Knapp, 8 News Now.
So this is the third report we've produced based on the state's emails. Tonight we are posting the entire collection of emails online so you can read them for yourself and trace how the asbestos controversy played out behind closed doors. You can read them now on LasVegasNow.com.